Hi everyone, I'm Anne Drastal. I'm the nurse at New Beginnings Healthcare, and we have a new therapy, and it's ozone therapy. And ozone is pretty neat because everybody needs oxygen, and how can you get more oxygen into your body? And ozone is a way that you can do that, and really simply. You can either put it in through your body through any different orifice that you have, your nose, your ears. We can even do it, I love this, through the bum or the rectal, or you can do an IV. I'm going to show you today how we can use it rectally in your ears and in your nose. And these are really, really good therapies to get increased oxygen. It also disinfects. It kills microbes on contact. This oxygen goes into your system and helps to reboot your immune system, which is really important. So that's a couple of reasons why we do ozone therapy. And now I just want to show you, because we're going to be sending these units home with you, and I want you to know how to set them up. So basically, I'm going to give you this lovely little machine. This is called an ozonator. This is called the O3 Elite, and this is going to generate the ozone from medical grade oxygen that we're going to also send home with you. All right, so when I send it home with you, I'm going to have this oxygen tube already attached to the oxygen. And then, because we want the oxygen to go into the ozone machine, it's a little screw connection that just screws on to the back of the machine. Actually, the machine actually says oxygen on it, so you can't miss it. And you just gently screw that on. And also there's a little plug, a power cord, so of course one end goes into your outlet and the other end goes right in here into the machine. All right, so you're almost done. Then I'm also going to when I send this home with you, I'm just going to put this little ozone tubing on. And it's very simple. And if you need to take it off, you can see it's just a little screw. It's called a lure lock, but so you can just gently screw that on. And then this is a protective device. And we don't want any water to go back into this machine. So this is a one-way valve. Only air goes out, and the water or air would not go back in, okay? So then this is our little tubing that we can put many adapters on, syringes and bags and different things to get ozone into a chamber that we can use, all right? So that is simple how you set it up. When you want to turn on your ozone to actually use and get ozone, first you're going to turn on your machine. Right now it's off, and these machines are very quiet. And so you can see when you turn it on, there's a nice blue light that goes on. That is your machine telling you it's on. Blue light special, it's on. So then, to make the oxygen flow into this machine to generate ozone, then you need to turn on your oxygen, which is through your regulator. So most oxygen regulators, these are pediatric regulators, and it's always when it's off when it's 0. Now on this little machine here, it has how much ozone is given per how much oxygen we're going to put through the tubing. So normally when you're first starting your ozone at home, you want to start low and slow, because we want to make sure you're not going to have any kind of ill effects from ozone, which are very, very rare, but we want to see how your body reacts. So I want you to always start at like a ½ liter per minute. So 1/2 liter per minute is only 13 gamma of ozone, okay? And that's a good place to start. So this 1/2, you're going to go here to 1/2. And first we're going to put on our little syringe or bag to catch the ozone, and then we're going to turn on, and you can see you have to go down here, and then up, there's 1/2, and up, there's that syringe flowing. So when you want to stop the flow, you have to turn it down to 0 fairly quickly, and then you can turn off your ozonator. And that's a basic getting of ozone.